So when a dentist, informs you that a crown requires treatment or a root requires treatment, so let's go over to the tooth section. So when you're slicing the tooth from one side to the other side, what all other structures you get to see, and also when you slice the tooth and see it under the microscope, what all other structures you get to see. So we will be discussing in detail about these factors. So now if you see on the left side, you can make out that there are two words written. That is, the top, on the top it's written as crown, at the bottom it's written as root. So the crown is what is white or the yellowish white you see when a person opens the mouth. The root is lying within the bone, and so you're unable to see it. This root is fitted into the bone, and this bone is covered by the gums. Okay, so keep this in mind. So it is the gums you see when the mouth is open, and you get to see the white colored or the yellowish white colored tooth. Now these features are similar whether you see it in any of the teeth, and even in case of the baby teeth and the adult tooth, okay, or the other adult teeth. Now coming on to the right hand side, so this is what you see when you slice the tooth. Okay, so what you will get to see is on the top you can read something called as the enamel. So this whitish or the yellow whitish color which you see is due to this enamel. Now enamel is the hardest structure in the human body, and um once formed, it cannot replace itself. Okay, so this is the peculiarity of enamel. It forms once, and it does not form again. Hence it's very vital to preserve the architecture of the enamel. Enamel is not supplied by blood vessels or nerves. Okay, now coming to the next structures. Now if you see, you can imagine the tooth like a body with coats and overcoats over it. Okay, so imagine the centralized portion, which is called as the pulp, to be your body. Okay, so pulp is where all the blood vessels and nerves will be present, and this blood vessel and nerve will be connected to the blood vessels and nerves of the jaws and to the face and to the different parts of the body. Okay, so keep that in mind. So from the body it goes into the bone, and then it goes into your tooth. So that is the pulp, where all the blood vessels and nerves and a lot of cells, regenerating cells, are present in the pulp. Now the directly outer coat is what is called as dentine. Now this dentine is present in both the crown as well as the root, similarly in the pulp. Okay, so crown pulp and the root pulp, so where the blood vessels are present, crown dentine and the root dentine. Now crown dentine and root dentine are made up of small canals, and these small canals up to some distance, okay, from the pulp into the dentine, the blood vessels or the nerves especially can reach through. So that is what is experienced as sensitivity. So when the enamel gets worn off, the next structure it encounters will be the dentine, and the dentine, it manifests, okay, this nerve endings manifests its sensation in the form of sensitivity. Okay, have you all understood that? So this is dentine. So crown dentine, root dentine, crown dentine, root dentine, and pulp can keep on regenerating. So once formed, even if it's destroyed, it can form again. Okay, but for that there would be time taken. Okay, it would take some time. So have you all understood that? So that is enamel, dentine. If you see on the right hand side, enamel, dentine, pulp. Then you have what is called as the cementum. Now cementum is like the cement of our buildings, but this cementum is it's a counterpart. Okay, so what you have as enamel on the crown, you have a similar structure, a hard structure in the root. Now the cementum is embedded within the bone. It is placed within the bone, the jaw bones. Okay, so this cementum is hard structure, but not as hard as enamel. Okay, so the cementum can be easily destroyed. Now within the cementum you again have the dentine and you have the pulp. Now the cementum, as I told you, it lies within the bone. Okay, but it is not directly connected to the bone. Okay, if it is directly connected, the condition is called as ankylosis. Ankylosis means there is a fusion, okay, there is a joining. So that is bad, okay, for the tooth. Now, why is this space necessary? Whenever the tooth is being chewed, okay, when chewing of teeth or food takes place, the tooth needs a place to move, okay. So it needs a place to move, and this movement can occur up and down, it can occur forward, backward, okay, side to side. So for this movement, there should be some elastic type of material which is present around it. So the cementum is connected to the root by what is called as the periodontal membrane. So you must have heard, if you all have visited colleges, okay, for your treatment, you would have heard about the department of periodontia. So this is where the periodontists concentrate on this periodontal ligament. Now, all these structures of the root are covered over by what is called as the gums. So when a person opens the mouth, all that we can see is the white or the yellowish white teeth, which is the enamel, and the pink color structure, which is a soft structure, which is called as the gums. So gums completely covers the bone. So there is a bone uh, underneath which you find the cementum, underneath which you find the dentine, underneath which you find the pulp. So that many layers to reach the gum. So when there is a gum problem, it would be normally involving the root, and normally the cementum is destroyed, the periodontal ligament is destroyed, and treatment is accordingly necessary. Okay. So if you see the second picture, you can see something written as bud. So that bud is what is called as the enamel. Then you have what is called as early cap, the late cap, bell. All these are stages just in the formation of enamel. So it forms in the shape of a crown, and what is present uh, in underneath it, okay, whatever is enclosing will be what is called as the future dentine and pulp. So that is why enamel is not supplied by any blood vessel, whereas the dentine and pulp, cementum, periodontal ligament are all supplied. They are all derived from the bone, okay, from the underneath bone. Bone is a very, what do you say, a very vascular structure, okay. It has got lot of blood vessels, nerves, etc. So that is why all the other structures are supplied by blood vessels and nerves. So the enamel forms from the gums. If you see in babies, they will be having a gum on that bone. So from that gum, enamel forms, and the other structures form from the in this diagram. The bud, cap, bell, okay, all these are structures. So from the gum, it goes into the bone and forms the enamel. Bud, cap, bell, all these help in formation of the enamel, okay, whereas the dentine, pulp, cementum, periodontal ligament arises from within the bone, like I said. The left hand side is a front teeth, okay. So there are three front teeth. They are the incisors, the central, lateral, and canine. And on the right hand side is what is called as the molars, the back teeth, okay. So if you'll see all the structures in the center, on the left hand side it is written as crown. So this is when, if you're talking about the upper teeth, so the crown will be hanging down. So you see the crown, and underneath you find, I mean on the top you find the root. On the right hand side, in case of the molars or the premolars, this is the architecture. So this is of the lower jaw, the left hand side will be of the upper jaw. So you can see in the middle there are wordings which is called as, on the right on the top, it's called as the maxillary alveolar process. That means maxilla means upper jaw. So that's the bone, okay, where you see a lot of holes. So it will be like a sponge, okay. If you see sponge, or a coral, okay, how you have the holes in between, similarly that would be how the bone will appear. The next two wordings are called as enamel dentine, which I've already explained. Then you have what is called a cemento-enamel junction. So junction between the crown and the root. Okay, when you see it under the microscope, it is called as cementum, that is of the root, and enamel, that is of the crown. So cemento-enamel junction. Then in the center, you have what is called as the pulp, okay, cavity. I told you the pulp is continuous in the crown as well as the root. So like consider that as the body. Then outer from that, you have what is called as the dentine, which is again continuous in the crown and the root. Okay, and then you again have cemento-enamel junction of the left side tooth, dentine enamel, mandibular alveolar process. So the upper jaw is called as the maxilla, the lower jaw is called as the mandible. So maxillary alveolar process and mandibular alveolar process, if you see, they are the coral shaped, or the cheese, okay, like Tom and Jerry, when you if you remember, okay, how the cheese is made up of some irregularly placed holes. That is how the bone appears. Into that bone will be the tooth will be embedded. Now these openings, okay, in the bone is where the blood vessels and the nerves enter. So they have to enter through somewhere to enter into the pulp, isn't it? Now again, another point which I want to add is that opening, okay, into the pulp is very tiny. Okay, so large blood vessels, nerves will be flowing through the bone, but when they reach the pulp, okay, the entry to the pulp, so from the underneath the blood vessels and nerves enter, the opening is very small. Okay, so and then it reaches into the pulp. So this is a now this picture, if you see, okay, now coming to this picture, this is the age of eruption of the upper and the lower adult teeth. Okay, so the upper teeth, central incisor, if you see, the age is written as 7 to 8 years, lateral incisor is 8 to 9 years, the canine, upper canine is 11 to 12 years, the first premolar, okay, between the front teeth and the back teeth, there are some in between shaped teeth which is called as the premolar. You have the first premolar, there are two premolars, okay, first premolar, second premolar. Both these premolars are not there in the baby set of teeth. So first premolar 10 to 11 years, second premolar 10 to 12 years, the first molar 6 to 7 years, the second molar 12 to 13 years, third molar is 17 to 21 years. Now coming to the lower jaw, coming to the lower jaw, this is given in reverse. So the third molar 70 to 21, the second molar 11 to 13, first molar 6 to 7, second premolar is about 10 to 12 years, the first premolar is about 10 to 11 years, the canine is 9 to 10 years, the lateral incisor is 7 to 8 years, and the central incisor is 6 to 7 years. So the lower teeth, if you see, they always arise earlier than its upper counterpart tooth. Okay, so the lower teeth always arises first, and based on that the upper teeth arises. Okay, it's not mandatory, but this is mostly how it is observed. So once you know this age of eruption, you can easily determine whether the tooth is erupting at the right age or not. So in some children, the teeth remain on and on for so many years. So the parent is worried as to whether the tooth is going to come about or no. Okay, in some cases, there will be no permanent or the adult tooth counterpart. So in that case, the baby tooth remains as such, or it doesn't fall. Or because of some malocclusion, teeth are not placed properly, that can also cause a delay uh, in the coming out of the adult tooth. Now this slide shows that of